Yeah, so what do you do? Let's say a patient, give an example, maybe a person have backache, chronic backache, and you need the patient to do a MRI, for example. Where do you send the patient to?
Generally, if a patient has backache, I think they will benefit from further investigations. Then we would definitely look at I usually offer them a range because there are various private imaging institutions, in Novena, Orchard. Yeah, so, and of course, I do have some preferred radiology centers. And I usually tell the patients that these are the options you have. I do prefer one over the other, and I prefer one over the others not because of the cost. Actually, they are a little bit more expensive, but because the quality of the reporting when it comes back is higher. I'm able to tell you with more certainty what the problem might be. So that's how I counsel them. The second type is, of course, some patients would prefer to use their insurance, and through the insurance, they may have to be seen by a specialist before they can go for an MRI. So then that would be the other route. Yeah. So generally, when it comes to investigations, I also feel that a lot of patients are in primary care are really under investigated. They're having a problem, but because they feel that primary care is supposed to be cheap or low cost, so when we recommend necessary investigations to sort of figure out the problem a little bit better, a lot of patients just reject and say, send me to a specialist. Actually, if we had done those investigations right there, and then we could give you a better answer, or even direct you to the more appropriate specialist. Because when we don't have enough facts, then sometimes you may actually go on a wild goose chase and go to multiple specialists.
That's right.
Yeah, so investigations, I think, are not really a big driver of care. In fact, they're actually more of like tools that actually help us streamline and direct you to the right areas for help.
Okay. Yeah, so I had the same problem as well. In fact, sometimes for investigations, I will have to use the public sector as well, because patients will find it difficult. Because some of this investigation, like MRI, actually they're not cheap. They're really not cheap. Or sometimes certain conditions, like autoimmune conditions, they need multiple series of investigations. Each one is not expensive, but you do that every month for one whole year, it's going to cost a little lot. So things like that. Then, of course, insurance. In my clinic, I do not accept any form of insurance, so it doesn't really affect me in a big way. So whenever the patient wants to use insurance to pay, I will just have to refer them out to somebody that the insurance company so-called dictate. So unfortunately that's not ideal. I don't quite like it, but I mean, for the sake of the patient's pocket, right? So for John, so as you know, sometimes I refer patients to you because there are certain investigations, just like what we said, right? Sometimes the insurance may not allow the patient to pay. So from that point of view, how do you try to order investigations to help the patient without bursting their pocket?
I think I will always say this is the best. For example, if someone needs an MRI, I will say this is the best, but it's gonna be more expensive. And I'll tell them the pricing range between a CT scan and MRI. And I say alternatively we can do an ultrasound. I will tell them my recommendation is do X and Y and Z. And they unfortunately, because if insurance doesn't cover, then the most important thing is the patient need to decide financially what they can take on in terms of the cost or impact. But I think the cost of the scans or the imagings in private is not gonna be it's probably on par, or if not slightly cheaper than your public hospital. Slightly cheaper. I guess because your public health institution, they need to cover for the electricity, the manpower, the other miscellaneous costs. But in private scans are cheaper. If you want to fast, and quality is very again we say healthcare food quality is variable, but you gotta know where to go. But it will certainly be cost is also quite good.
I observe a phenomenon. I'm not so sure whether it is rampant, but I see that in the last couple of years, maybe for the last 10 years or so, 5 to 10 years, I find that a lot of doctors, both public and private sector, so a lot of times for fear of missing out something. So generally they will order a lot of tests. So I see that in both private and public. And it's really quite opposite from what Kenneth said. Primary care, we don't investigate, or people don't expect us to investigate. And to the extent whereby sometimes I also wonder whether it is a matter of protocol. It's like I've seen patients with liver issues since they're liver specialists, right? So they're inpatient. It start off with an ultrasound of the liver. The next day they do a CT scan. The next day they do an MRI. Of course, in that sense, there must be a certain reasoning which I'm not privy to it. But from the look at it, it looks odd because you're like doing level to level, one day by one day, right? I can't really understand the logic behind. Have you seen that, and what do you think is happening?
If I can understand this correctly, I think the reason for that is obviously. So there are 3 modalities for the audience who don't know. There's ultrasound, there's a CT, and an MRI.
Yes, that's right.
You may or may not inject dye or contrast.
Oh yes.
Now, I guess in a public hospital, a CT scan there'll be a longer queue. So if I order today, I may get it not 24 hours, probably 2 or 3 days later. MRI could be for 3 or 5 days.
All right.
Ultrasound could be done the next day.
Okay.
So perhaps because of the waiting period, they say, let's get an ultrasound first.
Right.
And the ultrasound say, the report may say, there's uncertainty regarding the spot. And they say, okay, let's go ahead and do a CT. Because MRI will take even longer, so let's do a CT. So sometimes when you order a scan, there may be about 5 to 10% chance that you need extra scan. So in terms of the liver,
I've observed that actually. Rather common, I must say.
But I also observe some patients. They maybe you offer them an MRI, which is the recommended modality. And then they may ask the specialist, can I do a cheaper scan? And yet they still want the accuracy of an MRI and the quality of an MRI.
Correct.
How do you deal with such patients?
I will say, okay, if you really want, we can try this, but it's not recommended because it may not give you the best image.
I think so. They also bring to me and ask me.
Then
you haven't done the right image.
Then when they say they want to do X-ray, and it comes out. And they say, doctor, how come I don't know? How come you still don't know what's up? I said, well, this is the X-ray. And then in my mind, I was thinking, see, I told you. But I think it really, I think trust goes a long way.
Yes.
To develop personal relationship with your doctor, have a trust, and the doctor also will tell you very honestly what is the black and white, what is the reality here in terms of the scan, why we cannot give you the answers that you wish one scan can fix.
Right. I have also observed some among patients, public and private as well. Sometimes they may, like you say, order the MRI and take 4 days to get the appointment, right? If they're inpatient. And then if they're outpatient, they may take, the appointment may come 2 to 3 months later. So they opted to stay in the ward for additional 3 days. And these 3 days, probably nothing is done. But for the sake of an earlier appointment, they actually stay in the hospital. Is that common? I've seen a couple of them actually.
In public hospital?
Both public and private as well.
Haven't done that in private because the bill really racks up. In terms of the insurance anyway, if you are hospitalized, there's a 6 months to 1 year coverage anyway. So whatever outpatient scan you do after the hospitalization is reimbursable.
Right. So it doesn't matter for them to actually stay on or not. Right? Yeah. Kenneth, have you seen any of this like that?
No, not really. I've seen people who are hospitalized for the purpose of claiming insurance just for a scan that can be done outpatient.
Private,
okay.
right? Private insurance.
Yeah,
correct.
for private insurance.
Oh, okay.
Unfortunately, that's what they say, the buffet syndrome. They get admitted. I want to see a neurologist. I want to see a heart doctor.
Right.
I want to get my MRI of my spine.
Yes. I think I have seen also patients that was kept in the ward for another additional 2 or 3 days, waiting for the surgery. Now that one I can kind of understand and rationalize, because the OT space is this much. If you go home and you come back, your condition might change, your pre-op investigation you must redo again and all that. So it doesn't really make sense. It's probably okay. But for investigation, I rarely have heard of it, but I just couldn't rationalize why that has been so. Yeah.